that's really difficult to kind of overcome as well, especially if they have that belief and the spiritual belief.
We didn't know that that existed, and so we never addressed it until it was like they were out of the medicine and we needed to get more, and that's when the issue came up. So, I mean, I don't know if there's other issues like that, but we would approach things differently. I think
There's one, oh, right here, sorry.
Hi, Alejandro Contreras, Gender Health Center. To me, it sounds like you were working with a lot of migrant populations and possibly uninsured or undocumented. What kind of strategies did you use or conversations did you have with those individuals that were undocumented or were uninsured, and how did you navigate that trust?
So one way that we worked with the uninsured population was through certain smaller events that we would hold. So we held one event at San Francisco General Hospital. And San Francisco serves a lot of like undocumented, uninsured patients, and especially San Francisco General, where we have many patient assistant programs, we have translators on hand. And so by being there, you know, in their community, I think that serves as one of the best ways to like bring the information to them. Because I think like, having a lack of access would be one barrier, but if we're in the community that they live in, then that will help to increase awareness.
Also adding on, our school worked together with Medicare, so we would help sign up beneficiaries for a plan that was like best for them, that would also be the cheapest plan for them. And then we also had farm assistants that would help them with their medication costs. So we did have some programs that would help them at that health fair. So it wasn't just Script Your Future, we had a full-out health fair.
And then within my own clinic, as the clinical pharmacist, I deal a lot with medication access in terms of patients that are uninsured or don't have insurance. Where is the best way for them to get their medications? Is it going to be at Walmart with the $4 generics or Walgreens or CVS? Or is it going to be our 340B discounted program? Or should they go to patient assistance program, depending if it's a brand or generic? And so I think pharmacy and then student pharmacists can play that role in terms of determining where patients can get the most cost-effective medications.
Do you have like social workers that help you out that process as well?
Yeah, within my own clinic at Ole Health, we do have social workers that assist, but in terms of medication access, they usually come to me to ask about where the patients can get the medications at the lowest cost, but they do assist as well. Yep.
Mm-hmm. So I think we have time for one more question. Thank you.
This is more of a comment than a question, but I know in the various cultural groups that I've worked with here and abroad, we talk about cultural competency, and we talk about education materials in their native language. But what we found is that many times, even though we produced it in other languages, they couldn't read their own language. They are not they just can't read. And we also found with cross cultures, people immigrating into this country, that they very often do not speak English, but they have learned to read through their kids in elementary school or whatever, and they read English. We also found that many of the culturally competent brochures that we give out are written for Spanish. Many of my patients said, I cannot read this. It's written in Castilian Spanish. It's written in our high school Spanish. So it's grammatically very proper. And they would say to me, Joan, I speak Mexican. I can't read this stuff. So I think when we talk about cultural competencies, it goes beyond just having pre-printed, handing them something to take with them. And to understand the various cultures, I think one resource that we really have not addressed today that I am a proponent of, and that's community workers, to bridge the gap into the community, because if you don't know what's going on in that community, you're not going to get very far. And we can teach, and we've got some projects that are starting to take community members, and I think you might all look at one of your challenges and incorporate it, and educating health people. These are people from the community, they speak the language, they're culturally the same, and they can get information out and it will be accepted and not thought of as coming from the long arm of us. just a commercial on the end of that, our group is sponsoring in November. We're doing a cultural competency forum here, and we are honoring the immigrant and refugee population of Afghanistan, Syria, and there's one other that we're doing, but it's talking about cultural competencies and medical care and that kind of a thing. If anybody's interested, let us know and we'll send you an invitation. It's free.
Thank you. So I think what's wonderful is that the students here and the professors that are here today really talked about the multidisciplinary ways that you can reach communities and the way that you can do it, in a way that is really honoring their where the patient is at, whether it be language, whether it be culture, whether it be on the commute to work, or in an area. So it's really meeting the patient where they're at and where their needs are. And I think all of the participants, all the panelists today have really showed that they have gone above and beyond to do that and to make sure that, to really see the goal of making sure that patients understand and aware the importance of taking their medication. So again, a really big round of applause for everyone here. Thank you all so very much.
I was just, actually, I just want to follow up on what John said about, because I wanted to ask the panelists, since you guys work at the community level, that did you actually partner with the promotoras groups or anything? That was exactly my question on that. So, in you as a pharmacist, as a healthcare provider, you guys are the perfect partners to train the promotoras groups so they can actually go into the community. You guys have the language background. You can actually help the community and empower these community workers to go into the houses of the people and do the work themselves. But you guys are definitely the perfect channel, the perfect vehicle for this.
Thank you. Thank you so much. So I want to invite back up to the podium Vasudha Gupta, who again, she is a pharmacist and an assistant professor at California North State University College of Pharmacy here in the Sacramento area. And so thank you very much. You're going to be speaking about her presentation on assessing the impact of Scripture Future messages and materials. So welcome.
All right, thank you, Sarah, for the introduction, and thank you all so much for having me here. I see a yellow car, so I'm just going to say I'm grateful to be here and speaking with all of you. I'm going to implement that in my practice now. Okay, so as Sarah mentioned, I'm an assistant professor. I wish I got upgraded to associate, but I don't think that's going to happen for a number of years. But I'm going to be talking with all of you today about the research activities that CNU has done in collaboration with National Consumers League and Scripture Future. So financial interest, I want to thank National Consumers League and Rebecca Burkholder for the grant money that we received to be able to conduct this research project. Overview of the presentation today. So we've talked a lot this morning about the previous research that has been done in terms of medication adherence. I'm going to briefly give you an overview of that, but focus mostly on the current research project that we've done, talk about some of the benefits of the Scripture Future campaign, and then talk about the future opportunities of the lessons that we learned and how do we move forward from here. So we know there are many, many, many different reasons for non-adherence. There was a recent article published in the Journal of Managed Care Pharmacy that talked about different interventions to help improve adherence. So they looked at things like patient counseling, behavioral support, reminders, telephone-based counseling, et cetera. And what we found was that educational interventions coupled with behavioral support over extended periods of time led to either modest or moderate improvement in adherence. So the review also established some research priorities of what are the lessons that we've learned and how do we move forward into doing bigger and better things with medication adherence. So one of the things that they focused on was looking at what patients think and how do they feel about their medications. And this again goes back to a lot of what we talked about this morning about cultural competence and recognizing patient-specific barriers and identifying those to figure out what are the strategies that can help to improve adherence in these patients. So another research priority that was identified is to study the effectiveness of different interventions to modify patient behavior of taking their medications as prescribed. So we have, as I mentioned, worked really closely with the National Consumers League. As pharmacists, and I was really pleased to see Dr. Pan and Dr. Bogani be such advocates for pharmacists in clinical practices, because we're really probably the best people out there to be able to educate patients, because literally there's a pharmacy on every corner. And that's where patients go to pick up their prescription medications. And we're one of the most trusted healthcare providers with the most knowledge about medication. So we're in a perfect place to be able to educate patients. So what we wanted to see from our research project is whether an educational intervention by a pharmacist teaching patients about why it's so important to take their medications as prescribed, does that help them be more aware of the importance of medication adherence, as well as make changes in their actual self-reported medication adherence? So those are the two things that we assessed through our research project. So we included patients who were 35 years of age or older, and they were taking a prescription medication for one of the chronic disease states that's discussed through the Script Your Future campaign. So things like diabetes, hypertension, hyperlipidemia, asthma, COPD. So the patients had to have at least one of those and at least one prescription medication to be eligible for the study. We excluded patients who received help from a caregiver, and this kind of makes sense because we really wanted patients to be their own advocates and to be in charge of their own medication, so we can see whether they were able to implement some of the changes that they learned through the campaign and through the presentation. We excluded healthcare providers. Again, we know healthcare providers tend to be more educated about the importance of medications, and we really wanted to sample a more average patient population to see if we were able to make any differences for those patients. And then anybody who had attended a similar presentation in the last 6 months, we wanted patients with no prior knowledge of the importance of medication adherence. We wanted a blank slate. So again, we can measure that post-survey, and we could see whether we were able to make any changes in awareness for these patients. So what we did is the pre-survey consisted of 18 questions that looked at patients' current awareness of importance of medication adherence. So we asked very basic questions, things like, have you ever heard of the term medication adherence? What does it mean to you? When you have questions about your prescription medications, where do you go or who do you ask for that information? Are you aware of the types of questions that you need to be asking your primary care providers about your prescription medications, et cetera? The second part of the pre-survey included the Morisky scale survey that Dr. Lee talked about earlier this morning, and that's to measure patients' self-reported medication adherence. It's an 8-item survey, and it asks, again, basic questions like, did you take your medications yesterday? Thinking about the last 2 weeks, did you forget to take your medications, or did you miss your medications for any reason? Is there ever a time you feel burdened from taking your medications? So just basic questions to try to figure out what are their barriers and how often they're actually adhering to the medications. And then after the patients completed the pre-survey, they watched a 15 to 20-minute video presentation by yours truly. I was the star of that video presentation. It's on YouTube if anybody wants to see it when they go home today. And it defined what medication adherence was. So why is it so important for patients to adhere to their medications, and what does medication adherence actually mean? Then it discussed the reasons for non-adherence, so basic things like not being able to pick up your medications or being able to afford your medications, or if you're having side effects, et cetera, and some of the benefits and risks associated with medication non-adherence. And then in addition to that, we provided patients with resources, so things like referring the patients to the Script Your Future website to be able to watch presentations, print out the wallet card, and things of that nature, watch the videos that are on there. And we talked about tools, so things like calendars, pill boxes, alarm clocks, to again provide them some realistic things that they can implement in their daily life to help to remember to take those medications. 1 month after the patients completed the pre-survey and watched the video presentation, they completed a similar survey. So we wanted to know whether there was a change in their understanding of medication adherence. Really, I have 5 minutes? Okay. I don't know what to do. Okay. So we also, in addition to what we asked in the pre-survey, in the second part of the survey, we asked them whether they saw a healthcare provider in the last 30 days since we had first spoken with them, and what are the types of questions they asked during that visit with the healthcare provider. So what did our population look like? We had 166 patients, 52% males. 48% females. Average age was mid-50s, 80% were Caucasians, and they had a lot of different disease states. Education level and income, you can see there, and we had a whole host of patients, a big range, all the way from less than high school to graduate school or higher, and then income ranging from less than $15,000 to greater than $100,000 or more. So very diverse patient population. That's kind of what we wanted, a whole host of different patients. Some of our most significant results that we found in the follow-up group survey, patients, 50% said that they were moderately or extremely familiar with the term medication adherence as compared to the pre-survey. And that kind of makes sense because that was the basis of the presentation. We talked a lot about what medication adherence is. More patients in the follow-up survey could correctly define the medication adherence term. You can see the results there, and you can see that also from the p-value, this result was statistically significant. And then we also asked patients in the pre-survey, where do you go for your medical information when you need information about your diseases or your drugs, et cetera? And a lot of patients, not surprisingly, said that they were asking their family members or their friends, or they were looking it up on websites rather than going to reputable healthcare providers. But in the follow-up survey, patients said that they're asking the right people, so they're going to doctors and pharmacists, nurses, et cetera. So that was really good news for us. Other results, more patients in the follow-up group said that they were using calendars as one of the tools. And again, that's good news because that gives us information about the types of tools and resources the patients are using that they find helpful, so we can target our interventions using those tools in the future. Significantly more patients also reported that they knew what questions they should be asking their healthcare providers about their prescription medications. And these are the same 7 or 8 questions that are on the back of the wallet card that probably all of you have seen. So basic things like, what is the name of my medication? What does it do? What are the side effects can I expect, et cetera. So patients said that they knew what questions to ask. So hopefully our goal was that since they were more educated about their prescription medications, hopefully they're more likely to take their prescription medications. And this result was also statistically significant. We also asked patients what are some of the benefits you can expect. So you can see from the little table there, patients said that they will have fewer emergency room visits and more quality time to spend with their family and friends as some of the benefits of taking their medications as prescribed. Patients also recognize that their family will be impacted if they don't take their medications as prescribed. And both of these, or all of these results, were statistically significant. So that was great news for us. So something to think about and talk to your patients about because it makes an impact of how they view their medications and medication taking behavior. As I mentioned, we did do the 8-item Moriski scale, and we wanted to see whether patients' actual self-reported adherence improved. Unfortunately, even at baseline, patients were highly or moderately adherent to their medication. So when we did the same survey at 1-month follow-up after we educated them, we didn't see that big of a difference. Some of the lessons learned, so just a 15-minute presentation by a pharmacist, it can increase patients' knowledge of medication adherence and increase their awareness of importance of taking their medications daily. Hopefully, patients are going to the right people and asking the right questions about their medications, so it increases the likelihood of utilizing the appropriate healthcare providers and their awareness of the questions that they should be asking regarding each of their prescription medications. It increased awareness of the benefits of adherence and some of the risks of non-adherence. And our goal is that all of this knowledge that they have gained from watching this fabulous presentation is that it could influence future positive health behaviors. And we talked a lot about this morning that some of the previous research that has been done, it was pretty cumbersome, very involved, not really generalizable in a larger setting. And this is something that pharmacists and other healthcare providers as well, so nurses, physicians, they could easily implement an intervention like this in their settings because it's just speaking with a patient and talking to them about the importance of medication adherence. Future direction, again, as we talked about this morning, we really need larger studies with more patients, with a longer follow-up. Probably the 1-month follow-up that we had for the study didn't really allow patients enough time to see their healthcare providers and start making those changes in their medication taking behavior. You probably need at least 3 or 6 months to be able to capture some of those things. And of course, as we alluded to this morning, we want to be able to capture clinical outcomes, not just self-reported awareness or adherence information. Most of our patients in the study were 80% Caucasians, so we really would like to do a future study focusing on more minority and underserved populations because we know those patients tend to be less adherent to their prescription medications. Also, the patients in our study were mostly mid-50s, and they were 75% or more of those patients had an education level beyond high school. So we know that education really doesn't translate to health literacy, but we want to be able to focus on an older population who tend to be more non-adherent and patients with lower health literacy. And of course, we've had such a fruitful partnership with National Consumers League. Our goal is to continue working with them to continue spreading the message of Scripture Future to better our communities. Talked really fast. All right, thank you.
Have a minute or two if there's any questions. I should have. We really, we're so pleased to work with Vasuda and California North State on this project. We were always looking for ways to evaluate the campaign, and they had this great idea. Are there any questions before?
On your research, lessons learned, did you break that out by income in terms of how the people self-reported after 1 month? What was the low, what was the high? And secondly, from my experience, my family takes medication, but they take everything. And what we need is for someone to sort out, and I guess that's the question I'm asking, does the pharmacies sort out, well, my family's pharmacy doesn't, what they're taking, because sometimes they're taking medications that one doctor ordered, the other doctor didn't say.
Lots of miscommunication. Already forgot the first part of the question. It was, you were asking about the income, correct? Yes. We unfortunately did not tease that out. We did think about it, but our patient sample is so small that we wouldn't have really had enough patients in the different incomes to see a difference from pre to post. So we did think about it. Unfortunately, we did not do it. In regards to your second question, so I don't work that closely with community pharmacies. I'm in a clinic where I'm a clinical pharmacist where I do provide services such as medication therapy, reconciliation, looking at patients' diabetes. So I educate patients on their medication. So I know clinics are going towards that model of employing a clinical pharmacist there to educate patients about medications. But in terms of community pharmacies, I don't know if anybody else has experience with that. The pharmacists are always there to be able to answer questions. I don't know if they'd be able to spend time going through every single medication the patient has, but a lot of the pharmacies are moving towards more MTM services. I know Rite Aid is very heavily involved in something like that, where they're employing pharmacists to be at the pharmacy and do 30-minute appointments with these patients. The barrier is always getting paid for these services. So that's something I think we're continuing to work on in California. Perfect.
One more question?
Jerry Jeffy, California Chronic Care Coalition. I was just wondering, because we've had a lot of presentations during the day, particularly about Script Your Future. I was curious to know if a database has been created by Script Your Future or your organization to show all these student projects that were discussed. While a project may not have won, it still may have been a very valuable project for other organizations to look at, to implement, as well as just all the research and what's going on with the other cities too. And I was just curious if anything has been computerized so we can look these things up.
Yeah, well, a couple of responses to that. We are going to be putting the study that you all did on our website and featuring that. We do have information about all our pilot cities on our website, on the Script Your Future website, and you can also contact people for more information. I would encourage you to look at the report that's in your packet, actually, which has quite a bit of information as well. As far as the adherence challenge, we are hoping, with the help of the American Association of Colleges of Pharmacy, to really catalog all the projects, all the submissions, and have that available to people. Right now, it's not. It's just a lot of information. If people want access to it, we can. We're also hoping to highlight, and we've done a little bit of this before, some of the really quality videos and things that they have made and feature them on our website. So it's available by request right now, but we're hoping to make it all available relatively soon if we can get some support in kind of cataloging it. Okay? All right, thank you, Vasuda.